All right. This is a warning that the material we're going to be discussing today is of a sensitive nature. It's something nobody wants to talk about. It makes everybody uncomfortable, but it also affects nearly half of the global population. So my name is Caitlin Shirley. I'm with the company GI Gene, and today we're going to be talking about vaginitis, specifically trichomoniasis, yeast infections, and bacterial vaginosis, and how our product VA treats these common women's ailments. A little bit of background about vaginitis in the United States. 70% of women in the US will experience vaginitis. That is 55 million women, and of those cases, 40% of them are recurring, usually on a monthly basis. Now, this can manifest with mild symptoms like odor or discomfort, all the way up to really negative consequences like low birth weights, increased risk of getting HIV, infertility, and miscarriages. Not only that, but whenever you're going to get treated for an issue, you're having to go to a doctor who's going to prescribe you antibiotics. Now, many women do not have access to health care, whether or not they have transportation issues, or they're just very far away from a clinic, maybe they don't have insurance. Not only that, but as we all know, there are issues involved with antibiotics. There are antibiotic-resistant bacteria. Many people have allergies to antibiotics. And not only that, but they're not selective. They will kill the bad bacteria that may be causing your issue, but they're also going to kill the good bacteria, which is supposed to be in the environment, which, as we know, can cause further problems down the line. This actually is one of the contributors to recurring issues. So that's where we come in. Our product VA is an all-natural, inexpensive, over-the-counter treatment in the form of a tampon that is used to treat these forms of vaginitis, trichomoniasis, yeast infections, and bacterial vaginosis. So a little what we'll talk about today, we'll go over our competitive advantage, product comparisons, the size of the US market, IP and regulatory pathway, go-to-market strategy, customer segments, valley of death, and then end up on our timeline. So here's our packaging. Here's our packaging in its current iteration. We have done 135 official voice of customer surveys with many more unofficial conversations with women. And what we have heard from our feedback is they love that it is available over the counter, that it is made of all natural ingredients, no pharmaceuticals, no chemicals. It supports healthy vaginal flora. It's discreet to purchase and very inexpensive. And most of all, what they like is that it takes the third party out. It's empowering women to take their health into their own hands. So here's some of the background work that we've done. Here's our science. We've done background literature and IP reviews to make sure we're not stepping on anybody's toes. This hasn't been done already. We conducted over 100 lab studies. There's some pictures of one of our bacterial studies. On the left, you'll see a Petri plate that was subjected to bacteria plain, and on the right is at the bacteria after it had been treated with our active ingredients. You can see there are way fewer colonies after treatment. We also passed our FDA guinea pig maximization studies for a 510K. That means that our active ingredients are not sensitizers, they're non-irritants, and they are not cytotoxic. And like I said, we've done 135 of the official voice of customer interviews. Those are currently live on our website, and we're getting more every day. The major competitors for our product would be Monistat, which is a yeast infection medication that's available over the counter. Anybody who's used it will tell you it's messy, it's not a very pleasant experience, and it takes a long time to go into effect. Also, Flagyl and Diflucan, which are both antibiotics you have to be prescribed by a doctor. And we've already gone over the ill effects based on antibiotics. So again, our product is the only one that's available over the counter, made of all natural ingredients, helps good bacteria, is non-antibiotic, and also treats all three of these common ailments. So let's talk about just the US market here. That is a total available market that corresponds to $361 million. That is all women aged 14 to 49 in the United States. Our served available market is the subset of that is women who have trichomoniasis, yeast infections, or bacterial vaginosis, who are also tampon users. Since it comes in the form of a tampon, we need to have women who are comfortable with that. And then lastly, the specific market that we're going to be going after first for our very initial push is active women, so women who are fitness-minded, military women, and then we're going to be doing our advertising through social media, so online millennials. Here's our IP and regulatory pathway. We are patent pending. We've already gone through The patent examiner comments from a cursory look. He says everything looks like we responded correctly, so we're waiting to hear back from that any day. And then there are two different ways we could go down the regulatory path with the FDA. So we cannot actually sell our product until we are cleared by the FDA. The easiest way to do that is to go the homeopathic route. So we're going to start off going down a homeopathic route, and then as we're increasing our volume, we're going to go for a new drug application, which is a higher barrier to entry. But once you have a new drug application, you can say that you are treating specific ailments as opposed to relieving symptoms on the homeopathic side. So that's very important to us. Our go-to-market strategies, starting small, whenever we're doing our initial push through social media, we're going to be selling directly to consumer through online means, Amazon and our website. It seems like, that's a pretty obvious choice whenever you're doing your marketing on Facebook and Instagram. As we increase in our volume, we're going to be going into truck stops, the dollar stores, as well as selling through the military. And then lastly, we will be getting into the medical distributors like McKesson, Henry Schein Medical, to be able to get onto big box pharmacies. Our customer segments and market plan, something interesting we learned is that on a yearly, sometimes twice a year basis, any person in the military has to go through a health screening. And during these health screenings, people can set up product booths where you have access to everybody who is on that base who's going through the program. So through that, we can start with some local outreach to show off of our product. Like I said, 81% of female millennials get their advertising through either Facebook or Instagram, mainly. So we're going to be actively going through those channels and also engaging with fitness influencers for more targeted exposure. And then lastly, because we're going after that section of the population that's very active, we have found that for a maximum of $19,000, what you can do is get a sample of your product put into the swag bags that people get at the end of marathons. So for that amount, we can reach 86,000 women over the course of 9 events. That's a pretty good reach. Our Valley of Death, our lowest point is about $300,000. These troughs that you see in the expensive correspond to capital investments for equipment. So as we're increasing our volume, we of course need to automate the process more and more. So that's where these troughs are coming from. Our timeline, we're patent pending, like I said. We should be hearing back from that any day. And we'll expect to be getting our FDA clearance imminently. So maybe in a few months is what we're thinking. And then full new drug application in by October of 2025. So for $300,000, what we would do is put $175,000 of that towards building and equipment costs, $75,000 to FDA and regulatory fees, and then $50,000 for advertising and continuing on our packaging design. So overall, just to wrap it up, conceivably, this is a product that nearly half of the population of the world could use. We have gone our due diligence, made a strong supporting body of evidence for our product. We're patent pending. We're submitting our 510K imminently. And we've also done many market insights, and we've found that our go-to-market strategy as well. So we feel very solid on that. Here's our team. Angie Yonce is the inventor and founder. She has made many personal care products in the past. That's actually how we met her. So Monica Tyzak, she is currently the director of Mississippi Polymer Institute. She also has product and business management experience from DuPont and Chemours. I'm Caitlin Shirley, I'm the CTO. My background is that I've worked in the startup space for different personal care products on the lab side, so developing experiments and proving out technology. And then Dr. Heather Broadhead and Lauren Romine, both have worked in antibacterial materials as well as antipathogenic yeasts, and they have also worked in personal care products. And with that covers it. So I would like to open up the floor to questions and also invite Monica and Angie up here. So, thank you all.
Yes, so for example, monostat 3-day treatment would be $19, And we are estimating our initial pricing for rollout anywhere between $25 and $30 for 6 treatments. So it's a packet of 6.
Where's it going to be made?
We fully intend on making it in Mississippi.
It turns out that tampons are made out of materials that are very readily available in Mississippi, so that's great for us. I would love for there to be an R&D facility here once we start selling products. That's my space. There are multiple products under the GI Gene umbrella, but yes, we do want to be able to help those women who are not comfortable with using tampons for sure. So yeah, I mean, men actually have issues with these as well. There's a lot of research to be done in that space, something a lot of people don't want to talk about, but you get these issues from somewhere, it turns out. So. Anybody else? Yes. Oh, FDA and 510K. So Angie has been working on the FDA and 510K. She's been doing an amazing job, essentially teaching herself from scratch. It's pretty impressive. If you'd like to talk about that.
Basically, all we have to do is get the 510K cleared for the tampon. Right now, we are currently waiting on the absorbency test to come back, which should be back on the 13th, and then we can submit the 510K. Was there anything else?
So you asked about the background. We had no background getting FDA clearance for our products, right? So we've talked to many consultants for FDA approval and marketing of products. So, and Angie's tenaciousness has gone through and learned, and every FDA official we talk to says, yes, you're doing the right thing.
So far, anyway.
What are the patents for? Is it like that administered by the fund?
I mean, we're not going to discuss the patent actually up here, but I can tell you that our next correspondence with the USPTO should be a clearance. I mean, we should have an allowance for us to go ahead and get it issued.
We may discuss that off of the stage.
Yes.
Potentially. Yes.
I'm interested to know what the common denominator is with all 3 women. How did you get together? Give us some background on that.
So Monica and I both work for the Mississippi Polymer Institute. So we are an advanced materials entity at the University of Southern Miss. And Angie Yonce won a grant for a different product line that she had made through USM DGU. It's an advanced cleanser for extremely difficult greases and like mechanical type of liquids. So that was actually one of the first things I did at MPI was worked with her on the, she really had the recipe already, but scaling up that process of making the soap on a larger scale. So that's how we met each other, yeah.
Can I tell a story?
Sure.
So through several months, maybe a year of working with Angie, she came in one day and sat at our office and she says, hey, I've got this other product. I'm like, other product, Angie? No, stick on the one product you're working on. And she described it, and I kid you not, I said, I think you're smoking crack, Angie. There's no way this does this. There's just no way. No way.
She literally said, are you smoking crack?
And so we took it to the lab and we tested it, and by God, she was not lying. So I learned to be a believer. When Angie says something, I believe it from now on. And she said, I want you two to be a part of it. And we said, yes.
Well, I'm already pretending to be a lawyer and
Patent attorney.
yeah, I can't be all the science. I mean, I needed help.
Oh, yes.
So you're 135, I guess, esters, so to speak. What's the diversity background? Is it all white women or white women and black women and Hispanic? Because the body chemistries of the different races are so different. And historically, medications that might work or being tested
So there are actually FDA regulatory outlines that say you cannot do human studies until you've gone further down the FDA process. So we haven't done any human studies. All of these have been Petri dish based. But to answer your question, the majority of the people that we talked to, we went to Camp Shelby and talked to women who are in the military there. We talked to athletes on campus. I don't know if we actually have written down the demographic breakdown. It's a great idea for us to do that, but especially at Camp Shelby, it was a fairly diverse group of women.
You want to talk about the human studies in Japan?
Sure. There is some background information, well, some strong background information supporting the use of this in humans. We just have not personally done those tests. This is a Japanese study.
Yeah, it was in Japan.
Okay, does anybody else have any questions? Then I guess we're done. We would love to have more conversations about this during the break, which is coming up. And thank you all for listening. We really appreciate you guys taking the time out of your day to talk with us. Thanks.